My name is Daniel Kelly and I'm the President of the European Oncology Nursing Society. What I tried to do there was just to present the current situation, some challenges that exist. Europe, as you know, is quite a vast range of countries with different health systems, and nursing is very different in each of those. So I was presenting a bit of a range of the issues that nurses face. Shortages of nurses, lack of consistent training, the need for evidence-based practice, these sorts of issues that are facing nurses in whichever country they happen to be working at this point in time. I think the first thing is to understand what exactly it is that nurses are doing across Europe, because it's quite varied and we need some evidence base. So we're doing a 3-phase study. Phase 1 is to capture some of that evidence from published research. Phase 2 is to do case studies in 4 countries. And those 4 countries will be chosen to represent areas where nurses work to quite a high level and areas perhaps where they don't. Putting those 2 phases together, we'll have a 3rd phase where we actually try to influence some of the policy around nurse training, nurse education, and raise awareness of I think it's a real rising demand, more and more patients, fewer and fewer nurses. In the UK, there's a big issue around pay. Pay's dropped 14% in the last 5 years. So career choice-wise, nursing has to be made much more attractive. I think services need to be more innovative and responsive. And I think many things that are perhaps done in a very fixed way could be perhaps reviewed, and nurses' ideas could be used to make it more friendly to the patient's needs. So I think listening to nurses and using their expertise is very important. Recognition of the potential of the nursing workforce, better training, reviewing of career structures, and involving nursing, I think, much more when countries plan to develop their cancer services. I think if you don't listen to the nurses, you're really missing a trick. I think bringing people together is always a good idea, and listening to each other, hearing the latest research. And in this Congress, we've got multidisciplinary discussions. So the medics, the nurses, the patients, the other groups can put their views onto the table, and we can review the care in a much more rounded way. And I think that is the unique point of ECCO. And that's why we come to events like this. I think there's been a few interesting sessions. We had a discussion yesterday that I took part in about the concept of value in oncology. So what do patients value? What do we value? What does the industry value? And another one this morning with the ONS, which is an American Oncology Nursing Society. And we were looking there at the role of nursing in monitoring new therapies like immunotherapy, adverse events, patient safety. These are issues that are really going to be crucial in the future. So those are 2 aspects of the Congress that I feel have been really very exciting. Yeah, our big thing at the moment with EONS is our RECAN project, which we've really been advertising at this conference. So that's going to take up our energy for the next couple of years. But out of that, we hope that other things will spin out. So we're talking about some leadership training, we're talking about some innovation and creativity workshops, so that nurses who are actually very good at solving problems can be helped in countries perhaps where they're not so well developed, to really take a more leading role in shaping the nature of cancer care in those countries.